Hey guys, this is Josh Nelson with Nelson Elder Care Law, and we are blessed today to be joined by Bonnie Dobbs from the Bonnie Dobbs Agency. For the last 12 years, she's been an expert in the Atlanta area on Medicare and everything you need to know about health insurance as you age. She's a AJC panelist as well as a published author in the AJC. And again, we're just honored to have you here today, Bonnie. We've known you for a few years, and thanks so much for joining us.
Thank you for having me, Josh. I really appreciate that. And yes, I have been hanging out with you guys for like over 10 years. So I think we met in the beginning of the beginning.
Absolutely. And if you go to any kind of senior community functions or anything that has to do with insurance in the Atlanta area, Bonnie or one of her many representatives is usually out there helping educate the public about what we need to know. For me, even in this arena, it's scary to think about how little people understand their insurance until they really get into a bind. And that's one of the things Bonnie and her team are real experts at, is making sure that you have the knowledge and education you need to make the right choices. But just for those of us, again, that may not be experts on this like you are, what does Part A cover? What does Part B cover? Why am I getting these mailers for Part D? What all do I need to be thinking about as I go through this period?
Good question. Part A is on your Medicare card, it says hospital. But not only does it cover hospital, it covers skilled nursing and hospice. So if you only had Part A, it just covers you when you're sick and in the bed. I say that's the easiest way to remember what Part A is. On your Medicare card, Part B says medical. Now that covers a lot of territory. It covers your doctor visits, medical supplies. What that means in plain English is when you go to the doctor, what do you need? You need a Band-Aid, do you need a stitch, do you need brain surgery or a joint replacement? It's going to pay for your doctor to perform that service and then any medical supply he may need. Also under Part B falls test like MRIs, CAT scans, your therapies, durable medical equipment. So Part B covers outpatient. That's the easier way to think about a broad definition of Part B.
So we have people that have Part A and Part B, and that's usually what everybody's going to get whenever they get on Medicare. But then there's some other parts like Part D that a lot of our clients get mailers about. Can you tell us a little bit about what D is?
Absolutely. So original Medicare, Part A and Part B just covers hospitals and your doctors, those type services. It does not cover drugs. So Part D is prescription drug plans. And if you don't get a prescription drug plan when you first become Medicare eligible, you get a lifelong penalty. So it's really important to work with an agent so she can make sure or he can make sure that you enroll on time and with all of the various parts of Medicare. It's complicated.
I think a lot of people hear about these Medicare penalties and sometimes don't understand how severe they can be or that they really are lifelong penalties. When does somebody need to start thinking about enrolling in Medicare?
At my agency, we always like to start helping clients 3 months prior. That gives us ample time to give them guidance step by step, whether they're just turning 65, whether they're retiring past 65, or if they're under 65 and own disability. We can give them guidance on how to enroll, when to enroll, because the biggest thing is you want to make sure that you do this on time so you don't get a penalty. And then we also give them a class on Medicare because we never want anybody just to enroll in a plan and not understand, number one, what is original Medicare, and number two, we want to make sure that they understand their plan. So it's important to start working with people at least 3 months prior so we can go through all the phases. And as we go through each phase, they are learning about the process also. Okay, next.
That's really exciting. I think that a lot of people really take this decision for granted and don't realize how impactful it can be as we continue to age. You know, something that you have to make a decision on whenever you're only 64 or 64 and a half, going on to 65, that's really going to carry with you all the way until you pass, even if you live to be 100, right?
Yes, what people don't understand is when you first become eligible, there's certain plans that you can enroll in with no medical underwriting, and they have a grace period. And if you pass that grace period, you can never get on those plans again. And people don't understand the importance of when to enroll so they don't get a penalty, because penalties are for their entire life. It's not like you can pay it off 1 month or a one-time thing. It's every single month for the rest of your life. And it's also important to work with an agent that understands all of the different rules and regulations about Medicare so you can do it right the first time.
I think that's a good point. Bonnie and I probably have the same bias here, but it's the right bias to have in my mind. So often we talk to people who aren't even speaking with an agent, or maybe they're going to kind of a what we call robo agent or an online kind of portal to pick these programs, but without having the person to person guidance of really working with somebody, they often get put in the wrong product or service, signed up for the wrong plan. And so I think one of the biggest fears that most people have of getting a guide or a Sherpa, somebody to walk them through this, is what it costs. So give us kind of a background. What does it cost to work with your team, Bonnie?
I am so glad you asked that question. This is probably one of the most misunderstood conceptions about Medicare. First of all, the plans already have built the commission into the cost. So if you call a specific carrier, then they just pocket that money. However, if you use an agent, they pay the agent the money. Now, these insurance companies pay us a standardized commission, so we don't have any incentive to put you on this plan versus that plan. The important thing is when you're working with an agent to make sure that they're a broker. Now, an agent may just represent one company or maybe a couple, but a broker represents many or most all of the plans in any specific service area. So working with a broker can help you make the right choice the first time.
I think that's so important. And I just want to summarize a little bit what you said to make sure it's really landing on people. The price that they pay for whatever program they enroll in is the same for them, whether they go straight to the carrier or through a broker. So their monthly copay or their monthly premium is going to be the exact same. There's no savings going directly to the insurance company and trying to bypass the guidance a broker can give them.
That is true. And one more thing I would like to add to that. If you call a specific company, they're only going to offer you the plans that they have in their portfolio. If you call a broker, they have the flexibility to research every single plan in your service area. So I would much rather have somebody research all the plans available so I know that I'm getting the most benefits at the least cost instead of calling one company direct and now I'm kind of pigeonholed into whatever they may have in their portfolio, and they are not at liberty, and they just can't do it. They cannot compare all of the other plans in your area. So it's important to know that. I have agents that live in Georgia, but I also have agents that live in other states. When you work with a local broker, they write so many policies, or over at my agency, we write so many policies that we are very familiar with the plans that are available rather than somebody at random just researching one option, like making sure your medications are at a low cost, or making sure your doctors are in the network. But when you work with a local broker, I'll give you one example. I had a client call and she was like, my mother is in a nursing home. She needs physical therapy and it's costing $50 per visit. Because I write so many policies, I knew of a plan where she could get physical therapy for $15 a visit. Did I just change her life? Did I help her? Absolutely. And it's those type of things, those finite details that a local broker will have knowledge of just because of the influx of all the clients that they have in researching different plans. That's a very good question. I am so glad that you asked that.
So, like a lot of people that are watching this, you might already be on Medicare. And if you're already on Medicare, it doesn't mean that it's not worth reviewing your plan. I know that whenever we've worked with clients that have gone and worked with Bonnie's agency, they've really done a deep dive into where their situation is and what they think is coming up in the future to make sure that they're maximizing the benefits they can receive. Can you tell us a little bit about your process, Bonnie?
Absolutely. Whenever a client calls into our office, I have something called a discovery form. That form not only collects their contact information, but also all their medications, their doctors, their lifestyle. Do they have anything coming up? Like maybe they've been diagnosed with cancer or they need a joint replacement. We find out as much as we possibly can. And then during the actual interview, when we're talking with clients, we ask them, is there anything else that you would like to share with me? The more you can share with our agents, the better we can help you. And there's so many different plans. There's no one plan that fits all. That's the one good thing about Medicare. It's all about you. Okay? So first of all, we have the form that everybody fills out. Then we have an interview. We research every plan available for that client based on what their needs are and try to find one that's going to have the least out-of-pocket cost. Then we have an appointment, we go over the options, and we get them enrolled.
I love that. Definitely the reason why I think people work so well between our businesses is because at Nelson Elder Care Law, we pride ourselves on thoroughness, and it sounds like whenever they come over to you guys, that's exactly what they're getting. So a lot of times whenever we're watching this, even if we're on Medicare, some of the terms that you hear floating around can be a little confusing. One of the ones we hear most is donut hole. Tell us what a donut hole is, Bonnie.
The donut hole is very confusing, whether you've been on Medicare for 5 minutes or 10 years, okay? So first of all, whether you get your Part D drugs as a standalone plan or if it's embedded, built right into your Advantage plan, the donut hole is the donut hole and the same rule applies. So the way it works is for next year, because since everybody's looking at 2024 plans, the way it works is the insurance company can charge you up to $545 deductible. They may not charge you. Each company, it varies, okay? Then you go into what's called the initial coverage. In the initial coverage, it's your copay added with the insurance company's copay. So if the two of those added together add up to $5,030, then you go into the coverage gap, also known as the donut hole. In the donut hole, you pay 25%, whether it's brand or generic, until you've paid $8,000 out of pocket. Now, in 2024, they're no longer charging the catastrophic phase. So once you've paid the $8,000, you're done for the year. I wrote an article in the AJC in March of this year discussing the Tax Reduction Act, okay, that was passed. So they started it last year. They're implementing it a little more this year, but supposedly in 2025, the maximum out of pocket for drugs is going to be $2,000. Now, what they're going to do with the Part D monthly premium and the annual deductible is beyond me, but $2,000 is supposed to be the max out of pocket. I tell everybody, stay tuned.
One of the terms that we hear a lot from people as they're looking at different coverage options is, I've received in the mail something that talks about an Advantage plan. What's the advantage to an Advantage plan?
Well, the advantage to an Advantage plan is usually they do not have a monthly premium. They do offer the additional benefits like dental, vision, and hearing, over the counter, gym membership. But what they don't tell you about Advantage plans is the insurance company, not Original Medicare, decides on your care, okay? And also, there is a network of doctors. A good example, and this happened in Atlanta last year and this year, two large companies, United Healthcare went out of network with Wellstar, and Blue Cross Blue Shield went out of network with Northside. In August of this year, or September, Humana went out of network with Piedmont. That's three major insurance companies, and that's our three. If you live in Atlanta, that is the three major hospital.
Networks.
Thank you. Yeah, the three major hospital networks. So if you were on an HMO and an Advantage plan, okay, with those specific plans wanted to go to the specific hospital, you could not go unless you paid the entire bill. And some of those wouldn't allow you, they wouldn't allow you to come even if you had the PPO. So Advantage plans are great and were made for a certain population. The problem is people don't understand or don't know the rules. It's not like it's written somewhere. That's the reason why it's so important to use a broker so that they can educate you and explain all of this to you. Thank you for asking that question.
Yeah, I think with something like Advantage being in the name of Advantage plans, we all look for it. It sounds great. A lot of them don't even have monthly premiums, correct?
That's correct.
You're going to throw in a gym membership. Everybody likes a little, benefit here and there. But we're all intelligent enough to know that something's got to have a catch. If we're not paying out of pocket every month, there's got to be something on the back end that we're missing out with compared to something that could cost $100 or a couple $100 a month, like a traditional Medicare program. So I appreciate you sharing with us what those shortfalls are. We've had a lot of clients who sign up for Advantage plans because they're tight on the budget. It looks really good whenever you don't have those premiums every month. And then just like what Bonnie described, whenever something a little bit more serious happens, such as maybe you have a fall, you need to go through a hospital or rehab, even if you find the providers, getting approval for certain imaging procedures, or God forbid you need some rehab, especially physical therapy or something like that, a lot of times those Advantage plans tend to come up short.
You're right about that, because with the Advantage plans, there's so many different services that they require prior authorization. So while they're waiting for whenever the medical staff calls and they're waiting to get the authorization approved, you're laying in the hospital or sitting at home, and you may go for a couple of days before you find out. With a traditional Medicare and a supplement, you don't have those problems. So once again, it's important that everybody understand the rules of Original Medicare and a supplement versus an Advantage plan, because there's advantages and disadvantages to both of them.
And I know Bonnie can't speak on this, but I will go ahead and speak for my behalf. In my gut feel, it really does seem like the medical community doesn't treat people with Advantage plans the same way as with traditional Medicare. It seems like there's more bureaucracy, more roadblocks. And so if you are going to sign up for one of those plans, again, for certain situations, there are a lot of advantages, hence the name, but make sure that you have your Sherpa, you have your guide, you have an advisor and a Medicare broker that's walking you through those details and options before you find out that you're up the mountain without the help you need. So Bonnie, I know that October 15th through December 7th is really a great time to review this. It's open enrollment. Are there any other times of the year whenever people can make changes to their plans?
Absolutely. And thank you for asking that great question. So every year during annual enrollment, October the 15th to December the 7th, people can compare the plan that they're on with all the new plans that will be available starting January the 1st. Another time you can change plans is, now this is for people who are on Medicare Advantage plans only. You can take your plan for, I call it a test drive, use it in January and February, and then if your needs have changed or maybe you realize you did not make the right choice, you can, during the month of January, February, or March, change to a different Advantage plan. That's called open enrollment. Then we also have special election periods. Now, when you can change plans during that specific time. A good example would be like if you move. So all of these Medicare Advantage plans not only differ from state to state, but also county to county. So if you move even across the street, if you're in a different county, you can compare the plan that you're currently on with all the plans that's offered in that county. There's many other times. Another time when you can change an Advantage plan is if you're going into a nursing home while you're in the nursing home, or if you're coming out of a nursing home. Because let's face it, if you're in a nursing home, you're probably not having a good day, and I'm sure probably your doctors have changed, maybe your medications. And then when you're released, they may change again for long-term meds. So remember, whether you're moving to another county, another state, or moving in or out of a nursing home, those are just a few examples of when you can change plans. And then I would also like to add, some of these Advantage plans are specific. Like, did you know that there are specific plans if you are a veteran? So for the folks that's on TRICARE or veterans, there are plans that are made specifically just for that population. There's also plans that are made for people, we call them dual. That's people that's on both Medicare and Medicaid. If you do qualify for those plans, those are the ones that you see on TV where they say you may be missing benefits, okay? Don't ever call an 800 number from the TV. Call a trusted broker in your neighborhood. But those are the times when you can switch plans, and then those are some specific Advantage plans.
Awesome, Bonnie. Thanks for sharing that. It sounds like if you're on an Advantage plan, there's some flexibility, even if you find out that you need to change things kind of mid-year, or especially if something happens where you are relocating or your circumstances change. I would highly recommend reaching out to the Bonnie Dobbs Agency just to see what options you have.
Thank you, Josh.
Bonnie, it's been absolutely great chatting with you today. I appreciate you taking your time. Like I said, we are blessed to have such an expert, somebody who's a published author in the AJC, been running Medicare brokerage for 12 years, and just a pillar in the insurance community around us. How can people find out more about you and your agency?
Sure. I have a website. You can go to insuranceandotherredtape.com, or to simplify things, you can just go to bonniedobbs.com. And our telephone number is 770-373-7541. Thank you, Josh, for having me today. I really appreciate this. I hope I've answered your questions, and this will be able to help others in their path of learning about Medicare.
Absolutely. Thanks for being on, Bonnie.